for the last video for chapter 10, we're going to get into the appendicular muscles. So we're going to start with the pectoral girdle and the upper limbs, and then we'll go ahead and get into the lower limbs and the pelvis as well. So we're going to identify the muscles and then talk about some of their movements and functions as well. So let's talk about the pectoral girdle first. So these are the muscles that are going to help position the pectoral girdle, so muscles that help move it. So raising, lowering, shrugging, things like with the shoulders, like that, are going to help here. So we have the deltoid, which has been cut away. It's a triangular shaped muscle that goes kind of over the shoulder there. You can kind of see it goes over the entire shoulder, over the coracoid process and everything. We have the pectoralis major that's been cut away, right? And then underneath that, right, we see the pectoralis minor, so the little muscles running along the length of the ribs beneath that pectoralis major. And so this helps with like moving and pushing forward. So like if you were to do a bench press, right, that would be using the pectoralis major and minor. This serratus anterior, which is following along the lower ribs, right? So it's kind of similar to the pectoralis minor, except it's lower. The subclavius, which is a muscle that just goes down below the clavicle. And then if we go in towards the back, we have the trapezius. Again, this would span the whole thing. We've cut the trapezius away on the right. Right, and so this muscle, right, if it contracts, is going to help pull those, like if you were to shrug your shoulders, right? Trapezius can help with that shrugging of the shoulder. The rhomboid major and minor, so major is the bigger one, minor is the smaller one right on top of it, and that's going to help you kind of bring your scapula back towards each other. So if you were to kind of roll your shoulders back and pinch that in towards your spine, right, those muscles can help bring it up and over, right, up and back. And if we look at the muscles that move the humerus, right, so this is going to move the upper arm, pectoralis major will help with that, as well as the deltoid, right, so those guys are going to help, like if you're doing like a pushing out in front of you, right, or moving the arm like out, right, that would be the deltoid can help with that. So if you're to move your arms straight out to your sides, left and right, deltoid can help with that. Latissimus dorsi can help you pull your arms down and back behind you. So if you were to pull something down, right, like let's say there was something above you, you could pull it down towards your head, right? Latissimus dorsi will help with that. We have the subscapularis, which is going to be down below the scapula. It's going to help with rotation, right? So rotation of the humerus, so turning around a single point, will be what the subscapularis helps with. The teres major, which is right below that, right? So we can see it a little bit better. I'm going to point it out here as well as in on the posterior view. We can kind of see it from the anterior view here, but it's easier to see from the posterior view, right? So we see it kind of reaches out and attaches onto that humerus, right here, and as well as back onto that scapula. Right, and so it's going to help pull the humerus towards the trunk, so towards your body, so medial movement, right, moving in towards the midline. And on the back here, we also see the supraspinatus, right, which is going to be up here. Supraspinatus tells us where we're found, right, superior to the spine of the scapula, so supraspinatus. And so that's going to help pull the upper limb downward. It's part of your rotator cuff. So this is what's going to kind of help stabilize your shoulder joint and keep that humerus kind of locked in place, right? So making sure your humerus doesn't slip out of that glenoid fossa or out of that joint. This muscle kind of helps stabilize that so that the humerus doesn't slip out of its socket. And then also we see the triceps brachii. We see there, remember that triceps is named for how many attachment points it has? So it has 3. here we see the long head here, and then the lateral head, which is closer to the side of the arm over here, right? And so this is going to help with extension of the arm at the elbow. So you see it attaches across the elbow onto the ulna there. So this is going to help you extend that arm back out, so you can straighten your arm at the elbow using the triceps brachii. So the biceps brachii and so we have the short head and the long head, as well as the brachialis. These are going to work together to flex at the elbow. So you'll notice we attach up towards the shoulder, but we attach across the elbow. So we can pull on that forearm to flex to create a smaller angle. The triceps brachii that we talked about earlier, again, does the opposite. It's going to extend the arm at the elbow, right? Because it's extending across the elbow onto that ulna, so that when this muscle contracts, it's going to straighten that forearm out. The brachioradialis is also going to be a supporter in flexion at the elbow, so it's going to help the biceps brachii as well as the brachialis with flexing at the elbow. And brachioradialis, the name alone tells you what we attach to. It tells you we attach to that brachial region, but it also tells us we're attaching kind of along the radius. The pronator teres. Now, pronator tells us if it's prone, right, we're facing down, right? So the pronator teres is basically going to help you. So if you're standing in an anatomical position, right, pronator teres will help you twist your forearms so that your palms face back. This is going to be working together with some of the other muscles in the forearm, namely the flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis, which we're looking at here, as well as the flexor carpi ulnaris muscles. So these guys all are kind of like working together with that rotation, right, and flexion of the forearm. A lot of these flexor muscles too are going to help flex at the wrist, so bringing that hand in towards your forearm. So like if you're trying to touch your own elbow with your fingers on the same arm, those muscles will generally help with that. If you see flexor in the name, you should be thinking creating a smaller angle, right? So the ones, the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, and the flexor digitorum superficialis will also be the ones helping create that flexion at the wrist. Looking on the back end, right, on the dorsal view, so we're looking at the back, if we're standing in off the posterior view, if we're looking at anatomical position. We have the extensor carpi radialis longus, the extensor carpi radialis brevis, so it's just named on length and where we find them, right, carpals in the radius. Extensor carpi ulnaris, extensor digitorum, extensor digiti minimi, extensor pollicis brevis, extensor pollicis longus. You see a lot of extensor muscles on the back. These are all going to help straighten things out. So straightening out the wrist, right? So if you think how your wrist is going straight down or flexing back towards the back of your forearm. Extending your digits, so extensor digitorum and extensor digiti minimi will extend your fingers straight. The extensor pollicis, both the longest and the brevis ones, are going to help extend the thumb, right? Because that's what the name tells us, right? It's extending it out, creating a larger angle. And then the abductor pollicis longus. Remember, abduction is to move away, so this is going to help move your thumb away from the hand. We have the supinator. You can think of the supinator as opposite of the pronator teres. So think of them kind of being antagonistic to each other, right? So pronator teres turns out so your palms face back and away, whereas supinator, your palms are facing up or forward. We see the flexor digitorum profundus. So again, flex, we think you're flexing the digits, so curling your fingers in, same flexor retinaculum, right, so that you can You see that there's one on the thumb side, and we see it extending over across onto the pinky side. Right, so those can kind of bring things in. Pronator quadratus helps us turn, again, more turning to the prone position. So it's kind of performing a similar function to what the pronator teres is. In fact, they can kind of work together to allow you to turn your palm back so it is facing posteriorly. We mentioned a lot of the ones down here, right? Again, the abductor pollicis longus, the extensor pollicis longus are doing similar jobs. We're extending out the thumb as the extensor pollicis longus. The abductor one is going to move the thumb away from the rest of the hand. And then the flexor, right, we have flexor digitorum profundus, flexor carpi ulnaris. Again, those are going to help flex. So closing the angle in, right, closing the angle in. So a lot of, again, like I said, if you have the general terms and like the general Latin roots down, this isn't as bad because a lot of these muscles are telling you something about what they look like, where they're found, and what they do. Let's go ahead and look at some of the muscles we find in the hand. So we have the abductor digiti minimi. This is going to move the pinky away from the palm, away from the hand. The opponens pollicis, so this is like opposition. And so that's like a kind of a complicated action in the opposition of the thumb. So it's kind of a little bit of flexion, a little bit of adduction, and a little bit of rotation. We also have the same thing on the other side with the pinky, the opponens digiti minimi. So those two together, right? Think like if you move your, like they're complicated actions of moving the thumb and moving the pinky kind of inward rather than just like in a straight direction. The adductor pollicis, again, will bring the thumb in towards the palm. The flexor pollicis brevis is going to help flex, so bending the thumb. We also have the palmar interossei muscles. These are going to help bring your fingers, like adduction, so bringing them in towards the middle finger, versus the dorsal interossei muscles. And so these do the opposite. They're going to help you spread your fingers wider. Moving down, let's get to the pelvic girdle and the lower limbs. We're going to identify these muscles in the pelvic girdle and the lower limb and talk a little bit about how some of these move and function. Again, we're not getting into every single one of them because this could take forever, but at least talk about some. So let's talk about muscles we find in the thigh. So some of these we've mentioned before. We mentioned the psoas muscle when we were talking about the back and whatnot. This is going to help with flexion and rotation of the thigh. So you think it attaches all the way down onto that femur. And so this helps you kind of like rotate, like kind of flex and rotate the thigh a little bit out. It's going to help stabilize things, right? So when you're standing, it'll help stabilize your position. We have the quadratus lumborum. This is going to attach your 12th ribs to help stabilize your diaphragm. We saw it briefly when we talked about the diaphragm earlier. And this is going to give lateral flexing to your vertebral column and allow you to extend the lumbar vertebrae. So when this contracts, you can kind of bend back a bit. Moving down, we see the adductor longus. So adductor tells us what it does. It's going to help move that thigh in towards the midline along with the adductor magnus. So we have a little bit of information in terms of their shape. So longus, right, versus magnus, we think big. Longus, we think long. So it'll help move that in towards the midline. And then we have the four muscles that make up the quadriceps. The front of the thigh. And so there's four muscles that make up what you would know as your quadriceps, right? And that's going to be the rectus femoris, right? So rectus femoris, the vastus lateralis, the vastus medialis, and the vastus intermedius, which we don't see in this picture here at the top. So we see the rectus femoris, we see the vastus lateralis, we see the vastus medialis, but we don't see the vastus intermedius. These four together are what you would know of as your quadriceps. So it's the quad, right? Four muscles together on the anterior side of the thigh. So these are going to help you extend your leg at the knee all together. So they're working together on that action. We have the sartorius. The sartorius, the name is not straightforward. It has to do with talers, and it helps kind of like bring your leg, kind of like if you're trying to sit in like a cross legged position. So it kind of rotates your thigh laterally. It can kind of do a little bit of abduction, so sending your leg out a bit and then flex at the hip. So again, like if you were to try to bring your leg up, like if you're going to sit cross-legged, that's what the sartorius can help with. It could help perform that motion of the leg, kind of bringing it up and bring your knee out and then flexing, bringing your thigh upward at the hip. We also have the gracilis, this little one on the medial side here. This guy right here, hang out with the adductor longus. This is going to help with the internal rotation of the thigh, so rotating it in. So like if you're rotating your knee in towards the midline, that's what the gracilis can help with. And then the tensor fasciae, this is going to help stabilize your hip and your knee. It can help with things like flexion, rotation, and abduction, but usually we're thinking stability. Moving down, we see the obturator externus. Right, so this is going to connect towards that obturator from the hip, if you remember that, down towards the femur. This can help with rotation and abduction of the thigh. And then we have the three adductor muscles, right? We saw some of them from the anterior view, but they were kind of covered with like the sartorius, and you can kind of see them covered with the four different quadriceps muscles. But let's go ahead and look at the rest: the adductor brevis, adductor longus, and adductor magnus. Right, so these guys together, right, are going to help with adduction. Remember, that means moving it in towards the midline. And if we look over here at the posterior view, looking at some of the muscles that are forming the back of the thigh there, we have a bunch of muscles that are forming what we know as our hamstring group. And so these are the muscles that are going to help you flex at the knee. So most of us know them as the hamstrings, but it's actually a few different muscles that are working together. We have the biceps femoris right here. We have the semitendinous right here, and the semimembranosus, right, which is kind of running parallel there. So these guys here are going to help you flex at the knee, so kicking your leg back. So if you were to do like a butt kicker, if you're familiar with that, right, where you would flex at the knee and try to kick your own butt with your foot, these muscles would help with that action. We see the adductor group. Again, little bit, like you can kind of see them peeking underneath there, right underneath the hamstrings. We see the gluteus medius and the gluteus minimus and the gluteus maximus that have been cut away. These are the muscles that will primarily make up the buttocks. And so these are going to help with the hip joint, so extension, rotation, abduction, adduction of the thigh, so at the hip joint. Those guys will help with that, so being able to kick your leg out or move your leg in towards the midline, that's where these muscles can help with. We have the piriformis. It's going to kind of work together with like the superior gemellus, the inferior gemellus down below that, as well as the obturator internus and externus. So here we go, right here and right here. Right, these guys are going to help together when it comes to rotating the femur. So when the hip extends, right, and we move the femur out and away when the hip flexes. So it's going to provide some rotation and movement of the femur when we extend and flex at the hip. When we move down the leg, so now we're in the lower leg, we have the tibialis anterior, which is sitting right in front of the tibia, the fibularis longus, the extensor digitorum longus, the fibularis brevis, the extensor hallucis longus, the fibularis tertius, superior extensor retinaculum, and inferior extensor retinaculum. So some of these, the name tells us where it is or what it does. Anything with extensor, right, this is again going to extend things. So generally speaking, we're talking about dorsiflexion. We're talking about flexing the foot upward towards your shin. So these are muscles that'll help you like pick your foot up, right? So if you were trying to walk on your heels, right? If you try to walk on your heels actually and you flex your foot up, you'll actually feel a lot of these muscles contracting. Towards the back, we have the gastrocnemius. Two different heads, the lateral and the medial. This is going to be what forms the bulk of like your calf muscle when you think of the calf muscle. Right, so this is where we're looking at plantar flexion, so being able to point the toes down, like if you were trying to go on point like a ballerina, these muscles would be helpful for that. So the gastrocnemius, the plantaris, the soleus. This is also at the bottom of that gastrocnemius, we have the calcaneal or the Achilles tendon, and the calcaneus down at the bottom. So we're rooting all the way down to the heel. So again, these are muscles that are going to help with pointing the toes. So again, we call that plantar flexion. And then some of the other ones that'll help with plantar flexion include the tibialis posterior, the fibularis longus, the flexor, some of the other muscles that will help with the plantar flexion include the flexor digitorum longus, the flexor hallucis longus, right? These guys are going to, the plantaris, I think I mentioned over here, these guys are going to help point the toes downward, right? So these guys help plant the toes down, flexing at the calf. And then getting to the muscles that we find in the foot. If you notice the tibialis anterior, the extensor digitorum longus, hallucis longus, and digitorum brevis muscles are all rooting down from the lower leg into the foot. And this is why they're able to help. In this case, the extensor ones are going to help with dorsiflexion, flexing the foot up, right, the toes up towards the shin, right, versus the ones that help with pointing down, the plantar flexion, which were all the flexors, right? So we're looking at the bottom side of the foot. We have the abductor digiti minimi, and that moves the pinky toe away, versus the abductor hallucis moves the big toe away, right? The flexor digitorum brevis, this is going to help you like curl your toes under. So when you curl your foot or you're flexing or you're pointing your toes down, that would be the flexor digitorum brevis, working with the quadratus plantae, the lumbricals, the flexor hallucis brevis, the flexor digiti minimi brevis as well. Those two, though, the deep muscles for D, the flexor hallucis brevis, the flexor digiti minimi, those guys again will help you curl, right, those toes. Flexor, right, you think